Today, we are excited to announce another step that will significantly expand testing and allow us to move closer to our goal of testing every Hoosier who has symptoms of COVID-19. Over the next week, OptumServe, powered by Logistics, will launch 20 testing sites at select locations around the state and a plan to increase to 50 sites by mid-May. This will give us an opportunity to do nearly 100,000 tests a month initially and test 30,000 Hoosiers a week when all sites are open. The state reached an agreement with Optum as a way to expand testing to all symptomatic Hoosiers while allowing the Indiana State Department of Health to focus on targeted testing of high-risk populations. So to go through a little bit more detail, as I mentioned, OptumServe Health Services, which is powered by Logistics Health, is going to start opening sites next week. And again, a capacity to test 100,000 Hoosiers. So testing is for any symptomatic Hoosier as well as close contacts of positive cases or residents of congregate living settings. We're going to be expanding testing, and that will be evaluated on a monthly basis. OptumServe will collect the swab specimens and manage the testing and reporting of data. And people tested should receive the results within about 48 hours on average. ISCH strike teams will continue to test in long-term care facilities and other identified hotspots. Optum will be providing their own supplies, PPE, testing kits, staffing, and lab, which will increase Indiana's overall testing capacity. So we're expanding testing, again, to all symptomatic Hoosiers so that anybody can have the opportunity to get tested when they do have symptoms. And this will provide a more complete picture about the spread of the virus, not only in high-risk populations, but across the entire state. So Hoosiers can get tested without having to visit a healthcare provider. The State Health Commissioner, Dr. Box, has issued a standing order for the test so that any Hoosier who meets criteria can go and be tested. Again, we will continue, ISCH will continue to focus on those targeted areas, including high-risk populations with its testing. 20 sites will be opening in Indiana National Guard armories in the next 7 days, with 50 sites total to be open in the following week. Each site will be open for at least 8 hours per day, Monday through Friday. And once all 50 sites are open, as many as 6,600 Hoosiers can be tested per day. This map gives you an idea of where these first 20 sites will be available. We're taking into consideration going to areas that probably did not have or have not had access to testing previously. And so we selected those locations, and we'll continue to select locations on where the testing is most needed. So who can be tested? Again, anybody that has symptoms, so cough or cold symptoms, fever, shortness of breath, headache, sore throat. If you develop symptoms, then you would just go into a web portal to get scheduled and then go to one of these available sites. Additionally, we will be testing close contacts of infected persons. So if you are somebody who maybe your family member or someone that you have been in close contact with in the community has tested positive, you too can go get tested for COVID-19. And additionally, want to test the symptomatic Hoosiers who live in any kind of congregate setting. As I mentioned, you'll be able to go to the Optum portal and self-report your symptoms using their online screening tool. Register to get an appointment date and time, and the registration portal will be open about 2 days before the testing sites actually open up. And this is going to be an NP swab or a nasopharyngeal swab, and more information will come out in the coming days. No one will be charged for testing. Having insurance is not a requirement, but if you do have private health insurance, we do ask that you bring that information. Web registration is preferred, but there will be a call-in line when available. The results will be provided to the individual tested and also provided to ISCH by Optum. The patients will receive a text or email if the test is negative, and if the test is positive, you will receive a phone call. So once all the sites are open, up to 30,000 Hoosiers will be tested weekly, in addition to the ongoing ISCH testing. Optum testing will expand options for Hoosiers without impacting what we are already doing across the state. It'll be in addition to it. So again, the focus is on all symptomatic individuals, not just the vulnerable populations or the healthcare workforce, and will expand testing options across more areas of the state. Indiana is the second state that Optum has started testing in, as they started testing in California earlier this week.